Good morning, nursing students. This is your Special Agent Advisory Board, Megan Whipple, Holly Englehart, Erin Milady, and Alesha Green. Your mission for today is to discover why we should require standardized procedures for removing meal trays from isolation rooms. We have all worked as a CNA or done clinicals in different hospitals around the Treasure Valley and have noticed a disconnect regarding the policy for tray removals from isolation rooms. From the major hospitals, we have discovered there is no protocol for removing meal trays from rooms, whereas the VA will put meal trays in biohazard bags before removal. We have observed anyone from family to hospital staff removing trays that have come in direct contact with patients leaving rooms, potentially covered in millions of infectious microbes. This raises concerns regarding spread of infection to staff and other patients. In fact, rates of hospital-acquired infections among staff are increasing. The Occupational Safety and Health Administration, OSHA, reports that in 2011 there were approximately 6.8 workplace illnesses or injuries per 100 hospital workers, claiming that a hospital is one of the most dangerous places to work. According to the Center for Disease Control and Prevention, the recommendation for hospitals is to establish policies and procedures for containing, transporting, and handling patient care equipment and instruments that may be contaminated with blood or bodily fluids. There are a variety of stakeholders regarding this issue. Nurses, dietary, and support staff, including CNAs and therapists, along with patients and visitors, are stakeholders because they often remove meal trays without using precautions, and they are also at risk for infection from this issue. There may be a lack of education among these stakeholders about the policies or importance of removing trays. Also, these stakeholders may not realize that the room is on isolation, or simply they do not have sufficient personal protective equipment to remove the trays.
When examining the circumstances that contribute to the disconnect between staff members and isolation protocols, these are a few of the contributing factors. Meal trays, including the utensils on them, must be transported out of patient rooms because they are not disposable, but reusable.
Another contributing factor are rules, policies, and procedures. Procedures may not be easy to locate or clear in what to do specifically for removal of isolation trays from patient rooms. And even though policies may be in place, they may not be known or followed correctly. The location of patient rooms and patient rooms being close together may allow for more chance of spreading infection. They also may have to share bathrooms on certain floors. There is also only one central location where dirty meal trays are stored, whether the tray was removed from an isolation room or not.
Our goal is for healthcare professionals, family members, and patients to use a standardized set of isolation procedures when removing meal trays from rooms to prevent the further spread of disease. Our recommendation is to place meal trays in biohazard bags. This is the current procedure at the VA, and our hope is that other Treasure Valley hospitals would also follow this. An article from MedSurg Nursing explored reasons why nursing staff do not adhere to isolation precautions and alternative ways of training them to improve outcomes in this area related to the spread of hospital-acquired infections. The researchers concluded that by using a more hands-on, visual approach, learning was enhanced. A study from the American Journal of Infection Control aimed to see how well isolation precautions were being followed for patients with C. diff. The study observed 150 instances where a hospital staff member entered a patient's room who was on contact isolation for C. diff. Of the 150 observations, only 37% of hospital staff were fully compliant. Our budget considerations are finances for staff training on appropriate isolation protocols, finances for isolation tray bags, and finances for a computer programmer to include a checkbox in the charting system, noting that staff have removed the trays properly. One goal would be to include a checkbox in the charting system, noting that proper isolation precautions were used upon removal of trays from the patient's room. Another goal is to retrain the staff members on appropriate isolation protocols using a hands-on approach, showing staff members the appropriate way to remove meal trays from rooms and showing them the proper bagging of the isolation trays. The policy implications of bagging meal trays would be to see a decrease in the spread of infectious diseases that are acquired by patients after being admitted to the hospital. By using the teach-back method, staff, patients, and family can demonstrate their understanding of the proper way to remove the meal trays from an isolation room. It's up to you as future nurses to ensure that your patients and coworkers are safe from disease. Please help us spread these suggestions in your workplace. The world is counting on you.
Created using Powtoon.